So the topic of our talk is seeking wellness during your cancer journey. And the disclosure is that both Dr. Kollmorgen and I are on the board of director for Oregon Cancer Foundation. We are members of the American Society of Breast Surgeons who dedicate to the treatment of breast disease. We also keep on the National Registry approximately 2,500 patients now for the Mastery of Breast Surgery program. We're both certified for oncoplastic surgery by the School of Oncoplastic Surgery, as well as the Hidden Scar program. She and I actually are setting up a new surgical practice that is going to be coming out January 2021, and our center has been certified as a Hidden Scar Center. So that's our disclosure. So after today, this talk, you will be able to discuss non-surgical approaches to promote wellness, as well as ask about the innovative surgical techniques to increase wellness. Just remember that you have a voice and a choice when it comes to your treatment. So advocating for yourself is really important. We will also give you some resources that is pertinent to your care. Now, Dr. Kollmorgen will talk about this whole list of non-surgical approaches to achieve your wellness. And I will talk about surgical approaches to achieve wellness as well. So hopefully this talk will be enlightening to you and will stimulate some discussion during your discussion with your doctors. Go ahead, Chris, take over.
Well, good morning. Thank you, Winnie, for that great introduction. And thanks all for being here on a Saturday. I know that's a big commitment, but we're hoping that it's worth it for you. You know, what do we even mean by non-surgical approaches to wellness? I think that's a big catchphrase, and hopefully after listening for the next few minutes, you'll understand what we're talking about. You know, Winnie and I remove breast cancer out of people's bodies, but as you all know, anyone in the audience who may be a survivor, the whole breast cancer journey is far more than simply using surgery to remove a lump in your breast or even your entire breast. It involves so many other aspects of your life. In fact, it involves all aspects of your life. So the one thing that most patients encounter right at the very beginning when they hear that diagnosis is, how do I even talk about this with my friends and family? I mean, there's no blueprint for that. Fortunately, we do have some resources for that we share with our patients, and we hope to make these resources readily available. There are two wonderful books about this. One of them actually is written from England, so the language is a little different, but it's a lovely book, and they're just simple little approaches that help you talk to your family or your children in particular about your new diagnosis. On breastcancer.org, which is a website that we use quite frequently as a resource for our patients, there's also a whole section of that, and it's just a place to go, you know, where you can actually learn about such things. The whole concept of prehabitation is actually relatively new. People ask, what is prehabitation? I was just talking about this with my girlfriends. I'm actually in Manzanita right now having a little bit of prehabitation myself with some friends from across the country. And everyone thinks of rehabilitation or rehab, but do you know you actually need to prehab before you're about to run what I call a marathon race? You would never jump into a marathon without ever having done any training. And prehab is really training your body to get ready for the treatment it needs to undergo so that you can then eventually heal and be cured. So we talk to our patients about getting some exercise, simple things like 4 to 8 walks a day, or even 5 to 8 minutes of walking and exercise a day can help prepare your body for what it needs to undergo coming in the months ahead. Vigorous exercise is great if you can do it, but we don't ask you to go start doing P90X if you've not been an exerciser. Obviously, you want to fuel your body with the best nutrition possible, and we're going to really double down at Oregon Surgical Wellness on making sure that every patient who wants to has a treatment plan and a wellness plan prior to embarking on the journey. Stress reduction and smoking cessation, another just key element to helping your body heal quickly and successfully. Anyone in the audience that's undergone surgery or treatment knows, if you've never been there, there's almost no way to describe it. It's a nonverbal experience. I've had myself one simple surgery. In fact, Dr. Henderson was my surgeon, so I knew I was in really good hands. And I knew all the people around me. But even then, laying there on an operating table, looking up at uh, an OR light, not really being in control of my surroundings was very enlightening for me. And there are a number of things that we can do to make that experience more pleasant, and to be able to eventually associate that experience with something involved with treating yourself instead of harming yourself. There is a lot of evidence now coming out that actually preoperative therapy such as aromatherapy, um, hypnosis, stress reduction techniques, and even acupuncture and acupressure can help reduce the stress of all of your treatments. Most people think of acupuncture as something to treat post-operative pain or chronic pain, but actually there's very high value-based evidence that shows that some of these techniques can actually reduce uh, your post-operative responses. Post-operatively, we also talk about cold therapy, um, massage, uh, guided techniques for reducing stress, the use of muscle relaxants, and then there is a whole program called BRAS, Breast Recovery After Surgery, and we'll go into that in another slide. Chronic pain. Chronic pain really is defined as pain that lasts longer than about 6 weeks. Unfortunately, there are many women who do develop some mild to moderate chronic pain after the surgery. There's collateral damage, so to speak, of surgery and radiation treatments, and there's also collateral damage of the psychosocial aspects of your treatment. There are a number of uh, techniques that can be used, both psychological as well as physical, that can reduce chronic pain. And rather than just suffering with chronic pain, we like to talk about that with our patients. In the immediate follow-up, post-period, we speak about chronic pain and how there are uh, avenues to prevent it and avenues to treat it should you end up having some. Cognitive behavioral therapy around what causes chronic pain, in addition to acupuncture and acupressure, can dramatically reduce and even completely alleviate chronic pain. What about cannabis? Seeing as we're in a state now that is welcoming the use of cannabis both recreationally and medicinally, um, there really is no hard evidence to support that cannabis helps with the acute pain that may come about after surgery. However, there are evolving evidences that point to cannabis as being a key factor in alleviating or part of the puzzle to alleviate chronic pain. So we embrace that. So what am I actually talking about when we talk about, quote, techniques to reduce stress and postoperative pain? What's the science behind it? Has anyone ever been in the car and you're on your way to work, you might be a little stressed, and you turn the radio on, and suddenly that song that you just love comes on the radio, and you're by yourself and you either sing aloud to yourself about the song or you turn it up and you kind of get this hyped up or warm feeling inside. I'm sure everyone's experienced that. What even is that? what's actually going on physically in your body. That's actually your dopamine serotonin axis kicking in. It produces pleasure in the body. It reduces the sensation to pain. It reduces your sensitization to pain. And you actually might even walk in to work and you're glowing. You have this energy about you and it's contagious. Other people around you actually might feel it too. That's what that is. It's actually a physical thing going on in the neural networks of your brain. So there are things that can be done to trigger that. Something simple as playing a soothing song for 5 minutes before your surgery in your iPad or your headphones can really improve the experience, reduce your stress, and reduce the amount of post-operative dysregulation that you have. Aromatherapy works the same way. I've been anecdotally and hoping to use this more, using uh, literally fresh lavender from my garden. I've brought it into a patient. I put it in a little bag. I ask my patients, of course, if the smell is pleasing to them. And I have them just take a slow, deep breath of that before we go into the operating room. And I've actually seen patients clutching onto that little sachet of smell as they're going off to sleep. It really converts the experience from something invasive and scary to something more soothing, much like if you were going to go into a massage at a spa, and the patient wakes up happier. Acupuncture and acupressure, again, similar. Winnie is using this technique more than I am, but I plan to use it in a routine fashion. And this talks about just a gentle pressure in zone 6 on the wrist can do the same thing. We're talking about that dopamine serotonin axis kicking in and helping to relieve the pain receptors. Early lymphedema education and post-operative massage and compression, obviously key. I don't have a single patient who's not worried about uh, lymphedema post-surgical, especially when we're operating on the lymph nodes. And we have nice techniques to help pre-treat that, as well as treat it post-operatively should it occur. It's a big reassurance to patients to know that there are treatments out there to prevent sort of the scary lymphedema that people look up on the internet and see. And our goal is to prevent that completely, but if it occurs, just certainly treat it. Finally, the BRAS pathway is spelled out here. It's a technique that's promulgated at the ASBRS, preoperative teaching, preoperative medication with Tylenol, intraoperative local anesthetic block, obviously we give during surgery, postoperative Tylenol, a pain diary should the patient need it, careful postoperative follow-up, as well as reducing any side effects, obviously, for that mastectomy with lymph node dissection and or the sentinel lymph node procedure, which Dr. Henderson will talk about later. We want to make sure you know that after your surgery, we're still going to be part of your care. It's not simply have surgery, see us in follow-up, 2 weeks later, and then goodbye. We have a fully embraced follow-up regimen. It's a community standard. We're constantly tweaking it with our other partners at Willamette Valley and our primary care partners. And it's constantly evolving, but we stay up to date on the latest national standards for follow-up. Finally, many patients worry about some of the treatments that they're going to receive in terms of how it makes their whole body feel over the coming months and years. Tamoxifen is one of the therapies that we use in conjunction, obviously, with our partners at Willamette Valley. And many excuse me, women worry about what that is going to do to their overall sense of well-being. The good news is that many studies are coming out now that show that even if you can't tolerate the full dose of tamoxifen, even just cutting down the dose still gives you a benefit of breast cancer recurrence, but you can also see a reduction in the symptoms, thus making it a more tolerable therapy. And these evaluations are ongoing. So rather than just giving up the therapy because you have side effects that are affecting your lifestyle, we can tailor the therapy to how you're doing so you still receive benefit, but limit and minimize some of those therapies. Similarly, with radiation treatment, some patients with the following profile actually don't even need radiation therapy. So we're staying up to date on what actually is required, tailored to exactly your age and your type of tumor. There is no one size fits all in this situation. Um, you, this last topic actually is one of my favorites. Because it involves sex. Uh, one of the topics very few people like to talk about. I usually see patients in follow-up 9 months later, and that's really the time to say, how are you doing? Are you getting exercise? Are you sleeping? How's your sex life? Have you had sex since your surgery? Many women don't want to speak about this because obviously going through breast cancer treatment, your hormones have changed. Your body image may have changed. Um, your ability to have sex may have changed. And we go through different avenues to make sure that you're using the latest and greatest techniques so that you can enjoy a full and healthy life. Um, a simple thing like a sexual lubricant can completely change your function and feelings in the bedroom, so to speak. Uh, Coconut oil happens to be one of my favorite suggestions. It's cheap, it's easy to use, and most patients are really happy to know that there are things that can be done that help improve that aspect of their life. And they're simple things, and just opening the door to talk about it can make all the difference in the world.
So I'm going to briefly go over the surgical approaches to achieve wellness. Oncoplastic breast surgery is actually a very advanced technique of breast surgical oncology, where we are able to combine plastic surgery, surgical oncology, as well as reconstructive surgery. We literally mold the breast tissue together to give patients a nice breast mount. It's truly blending science and art. As you can see, this was pictures of years ago when I get certified, where we actually literally play with clay, so forming art, so to give your surgeons a aesthetic view of the world of the breast. We are certified Center for Hidden Scar breast surgery. With the hidden scar approach, your surgeon will be able to place the incision in a hidden location that's really hard to see, so that the scar is not visible. Now, the end result is that you do not have a visible reminder of your surgery or your experience with cancer in the future after, months and years later. So that's give everyone some happiness and wellness, at least mentally. These are the results of our surgery, and these ladies have different size breasts. And one other thing about these are all consented pictures, and we as breast surgeons often show breast pictures in our conferences and the presentation. And our goal for doing this is to enhance, enrich, and empower you. One of the biggest topic in breast surgical oncology is lymphedema. Lymphedema is a big problem, and lots of women are afraid of that. And as you can see, that there are lymphatics that comes from the arm, from the breast, and everything meets kind of in the armpit. So when you do surgery in patient's armpit, there is a risk of disrupting lymphatic drainage. And this is what we call secondary lymphedema, and is related to breast cancer treatment. Now, one of the biggest thing that has changed the entire surgical approach since 2010 was a clinical trial that came out with many patients who have undergone axillary dissection, which is removing all of the lymph nodes in the armpit, and sentinel lymph node biopsy, which is a newer technique where it's focusing on just removing a few. In comparison study, even patients with some metastatic, limited metastatic cancer, meaning cancer in the lymph nodes, have the same survival as those with axillary dissection, but axillary dissection actually cause morbidity such as really bad lymphedema that will affect patients' daily living. So we now have used sentinel lymph nodes biopsy mostly, but in some cases we still do axillary dissection for patients with bulky lymph node. Now, lymphedema, as you can see on the slide here, has different look or different stage. Stage 1 is mild. The stage 2 is something that actually with techniques we can reverse. Stage 3 is a little bit too late. In the figure 2 there, you can see on your left side is the normal lymphatic drainage in the arm, and on the right side is where it is disrupted. So it's definitely seen in our patients at times. With the sentinel lymph node biopsy, the risk of lymphedema is between 2 to 5%. With axillary dissection, the risk is usually about 30 to 50%. That's pretty scary. Another one of the lymphedema that people often not talk about is breast lymphedema. This is truly, it can occur to 50% of women undergoing breast surgery with lymph nodes removal, as well as radiation therapy. This is characterized by diffuse skin edema, swelling, redness, and symptoms of pain, which we encourage a patient to bring this up to attention because there are ways to treat this. So ways. Non-surgical will be early dissection, education, and prevention. And we will also refer patients with this problem to a lymphedema specialist. With those who have axillary dissection, we often will refer them ahead of time before surgery, so they will be able to detect any kind of swelling on their arm and start doing compression therapy and massages. Skincare is a big deal when it comes to lymphedema, exercising, lymphatic drainage. Now, Dr. Kollmorgen and I both practice state-of-the-art techniques, and there's actually a clinical trial that is ongoing right now with Dr. Susan Kleinberg for the axillary reverse lymphatic mapping. What this is that we inject dye into your upper arm, and we actually map out your lymphatics to avoid those lymph nodes or lymphatics that is blue coming from your arm. And in addition, we actually inject a dye, a radioactive dye into your breast. And we wanted to know if there's any crossover and try to avoid destroying or removing lymphatics and lymph nodes that are matters to your arm. And we also tie the lymphatics together to encourage recannulation. Dr. Klingberg, who I have met numerous times in conferences, has a mouse model that actually suggests lymphatics do recannulate, meaning coming together, just like the neurons in people's body. Now, when we recognize that patients have stage 2 lymphedema, we actually encourage them to have a consultation with specialized plastic surgeon who will do lymphatic-venous bypass or lympha procedure or lymph node transfer. These will procedure allow release as a scar of the lymphatics, as well as bypassing to actually get rid of lymphedema. And so having lymphedema is not reversible if it is recognized early. Now, we also pay a lot of attention to dog ears. It's a funny name for extra tissue under the armpit. When women have no reconstruction after mastectomy, they often notice this lump under the armpit where they are not able to wear a bra. It's very uncomfortable when they put their arm down. Dr. Kollmorgen and I both utilize techniques to get rid of these extra lumps under the armpit so that they will have just one surgery instead of needing to have second surgery for dog ears or being referred to other plastic surgeon to deal with this. As you can see, these are our patients. And we both utilize this VY advancement flap technique to get rid of the extra tissue under the arm. This patient is a patient of mine. It's fresh off the press. I just saw her on the 6th, and she's about 3 weeks out, and it looks beautiful. Now, you need to know that you have a voice and a choice, because oftentimes your surgical treatment has an effect when if your provider has bias. So you need to empower yourself with resources that so that you can make the right decision. These are the resources nationally that you can go to, that you can find information. In addition, here's a list. If you go to breastcancersurgery.com, you can get a list of questions to ask your surgeon. And breast360.org is an awesome resources. All of these articles, information are provided by the American Society of Breast Surgeons, and both Dr. Kollmorgen and I have been members for the last 10 years. 10 to 20 years, and lots of great information, such as the one, self-care and spiritual wellness for cancer patients. So with 1 out of women being affected in their lifetime with breast cancer, you need to know that there are options for your surgery. Hidden scar breast cancer surgery is one of the ones that will empower you to make you feel that you would not have to be reminded of your breast cancer treatment every day of your life. And we encourage you to look into this. You can find surgeons in your area by going to at least 2 sites, Hidden Scar Breast Surgery Program, as well as the American Society of Breast Surgeons. You can find a surgeon and do a member search. Dr. Kollmorgen are both certified again as hidden scar surgeon, and we've been member of the American Society of Breast Surgeons. We're very excited to bring you in January 2021 a very comprehensive surgical wellness center called Oregon Surgical Wellness, and we will be integrating, this is a beautiful slide in the middle where we integrate naturopathic oncology colleagues with care. They will be co-locating with us to treat your problem. And recently there is a targeting cancer series video that you can look up on the internet, and Dr. Michelle Neasley and Dr. Stacy Dunn talks about how they can increase patient safety and reduce your side effects while you're undergoing treatment. And they are 2 naturopathic oncologists with Pacific Integrative Oncology.